We did not come to Ecuador for the healthcare system. Hello everybody, Frank and Angie, just a few minutes outside of Cuenca, enjoying the beautiful scenery here. And today we're going to talk about the changes in the healthcare laws and how that stacks up with everything. Okay, so I got a few emails from people, having quite a bit of concern over the new healthcare laws. We're talking about compulsory collectivist schemes here, this one being healthcare. Apparently there's a big hubbub going on, people just getting upset and showing it. And, there's two sides to every story, but what I want to focus on today is, first let's get this out of the way. We did not come to Ecuador for the healthcare system. That wasn't even on the list at all. It's not like it was at the bottom of any kind of list. It wasn't even on the list. Likely there are a minority of people in the same circumstances. But it's well-known fact that a lot of the retirees come here for the healthcare system. That, to me, kind of puts people in a position, in a controversial position, because it's a conflict. I'm all for paying for what you use, user fee. In the 6 years we've been here, everybody knows we've had issues with stemming from bad water. And so when we need to use the system, when we need to use the healthcare system, we're more than happy to pay out of pocket. A lot of people are like that, but not all of them. A lot of people, I would say, I don't know, it's likely that a majority of them, they join this healthcare system so they can have unlimited amounts of healthcare. And apparently it put a strain on the central healthcare system here, so that the knee-jerk reaction kind of came out with this, well, we've got to charge more and we've got to compel everybody. Any thinking person knows that anytime you are compelled, which means forced, that's just nice words like mandatory or whatever, but you're being compelled, you're forced you're being forced at the consequences of law to participate in a compulsory collectivist scheme. That's what it is. Let's face it, that is exactly what it is. And although some people benefit from that, and some people likely a lot of people want that, but as I said, there's two sides to every story, and the system's got to get paid for somehow. However, here's the challenge with that. Again, I've said that we're happy to pay out of pocket, whenever we use it. A user fee seems to me is fair. Let's look at it this way, okay? I've got a question for you. If a system is so good, why do you need to compel people? I mean, if we want to go, if there's a good movie showing on Saturday night, right? Then we go and watch that movie. We voluntarily wait in line and pay the fee, and we go watch that movie. But it's tantamount to saying, oh, gee whiz, there's too many people coming now to watch the movies on Saturday night. We need to pass laws to compel everyone in the city to come out on Saturday night and watch these movies, so we can afford to allow everybody to pay for these movies, or whatever the stated reason is. And it's ludicrous. This is a loss of freedom. Thinking person knows that any time that you're forced or compelled to participate in some kind of scheme that you don't use, okay, because that's the key, you're being compelled to subsidize a scheme financially for other people that use it. Somehow somebody thinks that that's a good idea. You know, I mean, I think that there are other places, well, for example, in Europe, you've got such schemes, and I understand from some expats over there that it's possible to buy a high deductible healthcare scheme for a year for like $45. And this is Europe, folks. Now, I understand that the rates here are going to, they're talking about jumping up much, much higher than that. Okay. What is a fellow expat to do? Well, you know, to each his own, and everybody's situation is different. However, there are a lot of retirees that are being sold these places as a place to come live on Social Security, and being compelled into these schemes. For a lot of them that use it anyway, might be a good idea for them, but perhaps they won't be able to afford it depending on the fees. But then there's a lot of people that just don't really need to be, you know, they just don't need to use the system, and if they do, they're more than willing to pay out of pocket. So I'm more than happy to go to a movie on Saturday night. I'll be happy to pay the fee and wait in line because that's what I want to do. But to be told that I have to do this now every Saturday night to help pay for everybody else's ability to go to the movies whenever they want, well, that just makes absolutely no sense. And places like this that do these kinds of things are just, the way we see it, they're just putting another nail in the door, shutting the door on foreigners, foreign retirees. Why would anybody, you know, you can go to Europe and get a $50 a year healthcare system, and don't write in and ask me their name and address. I don't have that. That's not what this video is about. Regardless, Europe, South America, whatever, it doesn't really matter. Once you're being compelled into a collectivist compulsory scheme that you don't use, it's a loss of freedom. Let's face it. Let's be honest about it. Let's be truthful about it. You know, there are those, of course, people are at different levels financially, and for those that have ample amounts and just don't even look at prices, that kind of thing, perhaps it's just a minor inconvenience to them. But I'll tell you, there's a lot of folks on Social Security, and there's a lot of naturalists, you know, that come to these places because they can live naturally and free, and that's a big blow to them. I don't know, somebody thought this was a good idea somewhere, and perhaps there's a way to look at it where a certain way to do it is a good idea. Perhaps there's just a better or a different way to do it. Clearly, if a system is voluntary, then it is what it is. If it's voluntary, then it allows for the individual to have the freedom to choose and to have a user fee where a person wants to use it, they pay for it. If you want to raise the fees in order to use it, that's fine too. But please, don't compel everybody, especially people that don't use it, to have to subsidize the system. This is a big loss of freedom and unacceptable. Okay, we're talking about your retirement abroad, your retirement in Ecuador, the laws of Ecuador, the new changes in the laws of Ecuador, and how they affect you. We've had contact with expats that have written in. There was a lot of anger in the expat community coming out at these new laws, and that's why we're talking about this. When I first heard about this, you know, it kind of piqued my interest. I wanted to know, okay, well, what's this about? Why are people getting angry about this? And so we've done all of the research, and we've come across some information. I think you're going to want to hear this. It's pretty clear to me why some people would get pretty upset. So, okay, where do we start with this? One of the things that we like to do on this channel is cut through the to what really is happening, what's really being said, what's really not being said, cut to the chase, get to the bottom of an issue. And I think that we welcome other people, other bloggers to do it, but they don't do it. We have to do it. Somebody has to do this. Let me show you what I'm talking about here. This is, I'm going to tell you exactly what the law says and how it's written. And then I'm also going to tell you what one of the, I'm also going to tell you what one of the websites that bills itself as the largest blog on Ecuador, how it's being explained on that, just as an example, not to pick on anyone, but just to show you how people are seeing or not seeing this issue, and how they're being told things that are quite ambiguous, actually. First, let's start with the blogger here, on the information on the biggest blog in Ecuador that says apparently what they're doing here is they're mandating, but let me just show you what it says. This is the explanation on this popular blog, and it says, once the temporary residency is obtained, you can enroll in the Social Security system or other private health insurance. Now this is what I want you to focus on. The way this is explaining it is, again, once the temporary, I'm quoting, once the temporary residency is obtained, comma, you can enroll in the Social Security system or other private health insurance. Okay, let me tell you what the law actually says. Article 53.7, duties for foreigners. Duties. Have public or private health insurance while they're staying in Ecuador. Article 661. Once the temporary residency visa is granted, comma, the foreigner must be enrolled in the Social Security system or have private health insurance. You either are working and are enrolled, you're going to be paying Social Security taxes, which is understandable if you have a job or are working somewhere. But in the absence of that, you must have private health insurance. Now, did you get that difference? Once you have temporary residency, you can enroll in the Social Security system or other private health insurance. Okay, I don't know what comes to your mind, but this is what I think when I see this. I think this is at the core of the issue. I have a lawn, and I'm willing to mow my own lawn. I'm even willing to pay to have my own lawn mowed. But it appears what the law is saying now is that you must also mow your neighbor's lawn. So I now am required to mow my neighbor's lawn, or I am required to pay to mow my neighbor's lawn. Okay, and Article 64, once the temporary residency visa is granted, the foreigner must be enrolled in the Social Security system or have private health insurance. So this is mandatory. Okay, so it sounds like what the law is saying is that you either must declare whether you're going to be a worker contributing to the Social Security system and have access to that system, or if in absence of that, you must buy health insurance. And the way that the insurance is calculated is based on your income, and so it sounds to me like this is a tax. It's what do you guys think? This is a mandatory requirement, and it's based on income, which sounds just like another tax. It's targeted to the foreigners. The language of this says all foreigners. Duties for foreigners. This doesn't say duties for citizens. It says duties for foreigners. So this is targeted at foreigners. So foreigners have no choice. Now, there's an aspect to this law for foreigners that don't reside here that seems equitable. For example, all right, if a tourist wants to visit Ecuador and they're now required to have insurance coverage, yes, a lot of countries do that, a lot of countries don't. But what's important to note here is that a tourist or a visitor or traveler has a choice. They can say, well, gee, honey, look, do you want to go for a trip to Ecuador? They do require that you show insurance. And then you have a choice. You can say, well, gee, I don't know, maybe we should go to this other country that doesn't require that, since we are people that don't normally buy health insurance. Accentuated. Listen, I know a lot of travelers. I come in contact with a lot of travelers. I'm aware of a lot of travelers. They're just all over the internet. They do, tourists, travelers, and this kind of thing that are, they're self-insured. They are more than willing to pay out of pocket wherever they go, and still they do have a choice. They can go travel somewhere, and if they want to travel somewhere where insurance is required, they have a choice. They can either go travel there or not. And I'm aware of a lot of people that will not travel somewhere where insurance is required. They would rather go somewhere where it's not required, especially people that normally don't need or want insurance and are self-insured. They take care of themselves, and if they need to use the system, they use it, you know. It's like this. It's like, you know, like back to the lawn thing. I've got a lawn, and I'm willing to pay to cut my own lawn, to get my lawn cut. But, you know, to be told that I have to pay to cut somebody else's lawn, that's what we're talking about here. I am aware of a head tax that was repealed or removed in the United States back in the 1800s during the days of Henry David Thoreau. A head tax is just a tax that is levied uniformly on everyone regardless of their activity, and it has nothing to do with their activity. And this is what this is saying. It's saying that regardless of your activity, you've got to pay into this system. It's the form of a health insurance tax is what it is. And another thing is that it also includes family members and dependents. And so you have to pay. It seems to me that this would be an assault on families, especially families with small means. You know, if you have a family and you have dependents, you have a wife or a spouse dependent, and then you have other children dependents that are 18 years of age, you know, you're going to end up having to get insurance for everyone. And for families on small means, this is an assault on them, even more so. But without having to segregate families, I'm saying that for families it would be a heavier imposition because of the number of people. But really, for anyone, the idea here is that you know, it is an assault on personal liberty because you have no choice. Foreigners that aren't resident have choices. They don't have to come to Ecuador. And a lot of them won't. A lot of them will, but a lot of them won't. We're well aware of people that are already talking about not even coming to Ecuador. And clearly, if someone has a choice where to go visit, they have that choice. But again, this is an assault on not just families on small means, but it's also an assault on personal liberty. I just want to remind you that our Patreon members, right, the patrons and Patreon supporters of the channel, we can comment and communicate without having to be concerned about trolls and guerrillas jumping all over you. It's private, you know, the outsiders can't see it. So I just want to remind you that we're a community, and we can talk about these things without having to endure the verbal assaults of people that think that it's okay to do so just because they're on the internet. So that's where it's at, guys. I'm really sorry to hear that this is happening here in Ecuador. A lot of people did get upset. A lot of people are upset. A lot of people are talking about it. Mandatory taxes being billed as health care is what's going on here. And so, but I just wanted to say we love Ecuador and we love the people. The people are outstanding and they're amazing, you know, and we just love the terrain and the people and everything. And these kinds of things like this, we have to talk about these kinds of things because it's important for people to know what's really happening. We're going to continue this video in the private section. This is a sad day, really, for Ecuador. Okay, everybody, I hope you can have a nice day after all this, and as always, see you in the next video.